Good afternoon, and thank you for joining us today. My name is Lisa Haratunian, and I am Managing Director of the Health Policy Program at the Bipartisan Policy Center. Before we dive in, I want to highlight that live captioning is available by selecting the closed captioning option located on the toolbar at the bottom of your screen. The webinar is being recorded and will be available on BPC's website and YouTube later this week. Now that we've covered logistics, I'll briefly tell you about BPC and our work on aging and disability policy. BPC brings together leaders from across the political spectrum to develop evidence-based, pragmatic solutions to the nation's most pressing challenges. Through our advocacy affiliate, BPC Action, we work directly with policymakers to help translate those ideas into action. Today's event marks the exciting launch of BPC's three-year initiative on aging that we're calling The Aging of America, Forging a National Consensus. With the generous support of the John A. Hartford Foundation, this initiative will convene policy leaders and stakeholders across the spectrum, including those with experience navigating our aging and disability system, to build durable, bipartisan solutions that improve access to care, support caregivers, and strengthen financial security for older adults and individuals with disabilities. Every day, roughly 10,000 Americans turn 65, and within a decade, Americans 65 and older will outnumber children under 18 for the first time in the nation's history. And older adults are living longer and working longer. More are also aging with and into disabilities, with multiple chronic conditions and complex care needs. So these shifts are reshaping the economy, increasing burdens on families, and placing significant demand on an already strained aging and disability system. Our nation's long-term care system is fragmented and unaffordable for most Americans, leaving families to fill the gap, often at the cost of caregivers' workforce participation and financial security. Whether it's our own future or the parents, spouses, and loved ones we're already caring for, long-term care needs will eventually touch nearly every American family. Rising costs, fixed incomes, and barriers to employment force many older adults, caregivers, and individuals with disabilities into difficult trade-offs, often resulting in food and housing insecurity, worse health outcomes, and avoidable costs to families and taxpayers. At BPC, we believe these challenges are interconnected and must be addressed together, including through innovations that can ease pressure on the whole system. Today's discussion is the first of our three-part event series. We're joined by an outstanding panel of aging services leaders to examine challenges and identify opportunities to strengthen access to long-term care, nutrition supports, and housing for older Americans. We encourage you to submit questions for our panelists throughout the event by using the Q&A feature in Zoom, which you can find at the bottom of your screen. Thank you again for joining us and for your commitment to improving the lives of older Americans, caregivers, and individuals with disabilities. It is now my pleasure to introduce the John A. Hartford Foundation's president, Ronnie Snyder, for opening remarks.
Good afternoon, everyone, and thank you for joining us. I'm Ronnie Snyder, president of the John A. Hartford Foundation. And for anyone who doesn't know us, the foundation is a nonpartisan national philanthropy. We're based in New York City, but we operate all across the country. And we were established in 1929 by the family owners of the A&P grocery chain. We've got a mission to improve the care of older adults, and we do that through three priority areas: building age-friendly health systems, supporting family caregivers, and improving serious illness and end-of-life care. And I'd say we are an engaged funder that initiates and co-develops projects with national organizations to scale evidence-based care models and programs all across the country. So we're really pleased to support the Bipartisan Policy Center as it launches the Aging of America initiative. And aging is really one area where bipartisan collaboration can make a really meaningful difference, and it has been for a long time. I'm going to give you two examples of that. First, the Older Americans Act, which funds state and local services that help older people remain independent. And I'll note that 2 weeks ago, reauthorization of that act was unanimously passed in the Senate, so we're happy about that. And second, the National Strategy to Support Family Caregivers, which aligns federal and other stakeholder efforts to better recognize and support family caregivers. That was signed during Trump 1 by him, carried out during the Biden administration, and is continued now during Trump 2. So now more than ever, it's really critical that we come together to ensure that all older people and their caregivers can access the care and the support that they need. Our nation's changing demographics alone demand sustainable and ultimately well-crafted policy solutions. So if we get that right, there's an enormous opportunity to reap the benefits of longevity and the vital contributions of older people. So in closing, I want you to know that we have an amazing network of grantees who are advancing research, informing policy, and developing practical resources that can ultimately help policymakers improve the lives and health of older people in our communities right now. Please stay connected with us through our website, our newsletter, other places where we frequently share resources. And I'm going to now hand things over to Bob Blancato, himself an expert in aging policy and a policy advisor to our foundation, because he's the moderator of today's panel discussion. Bob.
Ronnie, thank you very much for that nice introduction and those good comments. It's an honor to join this event as your moderator, and panel, please join me. I'm Bob Blancato, the Executive Director of the National Association of Nutrition and Aging Service Programs and the National Coordinator of the Defeat Malnutrition Today Coalition, both groups deeply involved in older adult nutrition issues. Today's webinar is a key component of the BPC's important initiative, as was mentioned, the Aging of America, Forging a National Consensus for 2029. I've been pleased to be involved in this initiative from the early days, and I hope to continue. But now let me go to my assigned role, and let me first now introduce our distinguished panel. First, Allison Barkoff is the Harold and Jane Hirsch Associate Professor of Health Law and Policy at the Milken Institute School of Public Health at the George Washington University, and Director of the Hirsch Health Law and Policy Program. Prior to George Washington University, Professor Barkoff led the Administration for Community Living, serving in the role of ACL Administrator and Assistant Secretary for Aging from 2021 to 2024. Beth Kowalczyk is the CEO of the Ohio Association of Area Agencies on Aging and a licensed attorney, where she advocates for older Ohioans and the area agencies on aging with Congress, federal agencies, the Ohio State House, state agencies, and others. Kim Fitzgerald is the Chief Executive Officer of Cathedral Square, a Vermont-based nonprofit that has provided affordable housing and supportive services for older adults and people with diverse needs since 1977. Cathedral Square created and administers the SASH, Support and Services at Home model, available statewide to Medicare recipients. And finally, and last but certainly not least, is Tim Getty, the Regional Nutrition Services Coordinator for the Heritage Area Agency on Aging, and is responsible for the coordination of nutrition-related services for older adults, such as on-site dining, Meals on Wheels, and nutrition counseling for 7 counties in eastern Iowa. So, to the extent that you can clap, welcome our panel. And we love having them here. And I will tell the audience, as Lisa did a minute ago, that the panel will respond to audience questions at the end, taken from those submitted during event registration, and encouraging viewers to submit questions throughout the panel discussion using the Q&A feature on Zoom. So let me begin. We're going to first focus on the landscape of long-term care, nutrition, housing, and other supportive services. So Allison, we could kick it off with you. How would you describe the role of long-term care in supporting healthy aging? When you think about how long-term care is currently delivered nationally, what program complexities and gaps in access stand out to you today, and what emerging challenges are top of mind?
Well, thanks, Bob, and thanks to BPC for holding today's event. And I want to start by really building off some of the framing comments that Lisa made. We have an aging population in this country with more than 11,000 people turning 65 every single day, and people who are living longer, with a growing number of people who are 80 and above. We know that the vast majority of people are going to need long-term care in their lifetimes. The statistics from HHS are more than 70%. And the older people are, the more likely they are to have more significant long-term support needs. Yet the inherent problem is we do not have a long-term care system in this country. Most people mistakenly believe that Medicare covers long-term care. It does not. Private health insurance doesn't cover long-term care. The long-term care insurance market is very small and unaffordable to most people, and the vast majority of older adults cannot pay for long-term care out of pocket. So that leaves Medicaid as the primary funder of long-term care. But it's a poverty program that has strict income and asset limits. And for many older adults to be able to access Medicaid, they would have to spend down to become eligible. And even when they do, most people want to age in place and stay in their own homes. But unfortunately, Medicaid has what we call an institutional bias, where institutional services like nursing homes states must provide, but home and community-based services are optional. And many older adults are sitting on waiting lists to get the home care that they need. I'll just mention there is an interconnectedness, as Ronnie talked about, between long-term care and family caregivers. And the barriers in accessing care have led to a huge growth in family caregivers having to fill those gaps with more than a 50% increase over the last decade. And it's not just more family caregivers who are providing care, but it's people providing more complex care and more care at significant financial cost, including about $1 trillion a year, more than our country spends on all formal long-term care across all payers. So I'll just end by saying that is the barrier. That is the complex issue. But I think as we'll talk about over the day, there are some opportunities, there are some innovations, and there's some momentum, including, I think, some new visibility and energy around the issue. Bob, thanks.
Thank you, Allison, very much. Tim, we know, you and I know, that not enough people in Washington know that long-term care for older adults is most effective when complemented by other supportive services such as housing, transportation, and nutrition. Given your expertise, could you please speak to some of the key challenges older adults face in accessing nutrition and how improved nutrition options in your state have improved the health and safety of older adults?
Well, thank you, Bob. One of the significant challenges that older adults are currently facing is access to available resources, especially for those of older adults and specifically in rural communities, but also throughout our entire state and also nation. The Older Americans Act programs act as a front door, if you will, for additional services such as housing, transportation, case management, what have you. Our nutrition programs include congregate or on-site dining, have uncovered serious needs in situations with our consumers, including elder abuse. These situations were not uncovered until staff and volunteers established a relationship and started visiting and building a personal relationship with the consumers. Many older adults also live alone and find it very difficult to help prepare healthy meals for a healthy diet. For example, in FY26, what we just completed, 71% of our home delivered consumers were at high nutrition risk. And for congregate consumers or on-site diners, 29% were at high nutrition risk, meaning they had one or more issues that would put them at nutrition risk for institutional placement. And then additionally, social isolation is also a very real challenge. It can lead to additional medical concerns such as weight loss, mental health issues, compounding of other existing medical issues. And between FY24 and FY26, we experienced a 9% increase in the number of our program's consumers that were socially isolated 18% are currently socially isolated in our cafe program. And additionally, in Iowa, the Area Agencies on Aging established dining locations and restaurants using a voucher system, and Heritage implemented the Encore Cafe pop-up model. This model has been successful in getting nutrition services to older adults, especially in rural communities, and also as a side benefit, it has also benefited small local businesses that might not have grocery stores in their towns, also increase the business landscape. And in FY17, Heritage had one of the top 10 fastest declining congregate participation programs. And after the implementation of our program and the state program, we were one of the top 10 fastest growing congregate programs.
Thank you very much, Tim. And I just want to add that, as my colleague Ellie Hollander from Meals on Wheels America would say, you just dramatize how it is more than just a meal we're talking about in this program. And the socialization part may be the most important thing, which is written into the law. It's supposed to provide socialization. So thank you for the work that you do. Kim, stable housing is another important health-related social need for older adults, especially as HHS reports that individuals over 50 years old are the fastest growing population experiencing homelessness. What are some of the key challenges older adults face when accessing housing? And how is Cathedral Square and the Support and Services, or SASH model, working to address this in Vermont, especially as a growing number of these individuals are aging with and into disabilities?
Thanks, Bob. Yes, housing is healthcare, and it's actually encouraging that more people are recognizing that connection. Vermont is second or third oldest state in the nation, depending on what statistic you use, and we are facing a severe housing crisis. Vermont's vacancy rate is currently about 3%, and it has been under 1%. It has taken Cathedral Square nearly 50 years to fund and build 1,100 homes or apartments for those 55 and older, disabled, or with special needs across our 28 communities. And even if we could build that many tomorrow, it would still not meet the needs of the more than 1,300 people we are seeing on our wait list today. We tell folks it can take 3 to 5 years to get into a Cathedral Square community. At the same time, building costs have skyrocketed. It now takes far more funding sources to create affordable housing. I know when I joined Cathedral Square 26 years ago, a project typically required 2 to 3 funding sources. Today, it can take as many as 18 sources to bring a property to completion. Since 2020, Vermont has seen a 200% increase in its homelessness count. We are fourth in the nation for homelessness per capita, and 8% of people experiencing homelessness in Vermont are 65 or older. So, what are we doing? First, we are continuing to build as much age-specific affordable housing as we can. 93% of our residents have Section 8 subsidy or live in a tax credit apartment, so affordable housing is key. Second, we created, as Bob said, SASH, which stands for Support and Services at Home, 15 years ago. SASH is a proven model that saves costs, improves quality of life, and helps older adults live longer and remain in their homes, whatever home may mean to them, by bringing services and support, which actually consist of a SASH coordinator or care coordinator and a wellness nurse, that's an RN, directly to them in partnership with local service agencies. Most recently, SASH was funded under Vermont's all-payer model, and we are now looking toward opportunities through the Rural Health Transformation Program. Senator Sanders has also written a Dear Colleague letter signed by 15 senators across the nation to support replicating SASH in other states. And third, we've created HIP, which stands for Housing Incentive Program. It's to incentivize people who were previously unhoused and now live with us to continue engaging in services and to create a mechanism for saving over a 5-year period. At the end of the day, accessible, affordable housing with services would allow older adults, especially those aging with disabilities, to stay housed, stay healthy, and age with dignity in their community. Thanks, Bob.
Thank you very much, Kim. And as Allison alluded to, we're going to switch next to highlighting innovative practices and policy opportunities. So Beth, we didn't forget you, pal. We got you. It's your turn. Ohio has long employed innovative ways to provide a variety of long-term care options to older adults and individuals with disabilities, including utilizing Medicaid 1115 and 1915C waivers to transition eligible individuals into assisted living facilities. What is the value of this and other innovative methods that states can employ to provide long-term care in the right setting at the right time for older adults?
Thanks so much, Bob. I think you've heard a variety of things that older adults need and caregivers need to support them so that they can remain where they want to age, and primarily, which is in their homes and communities. And I wouldn't say it's an innovation because it's something that's been in place for 50 years, but remains the best kept secret. And I hate to hear that, but the area agencies on aging, which have been around for 50 years, were established through the Older Americans Act, and they are across the country. Every state has at least one. Ohio has 12. They are the glue that really holds all of these supports together and also connects them with healthcare. So in serving older adults and supporting them and their families, it's much more than the healthcare component. And so, in Ohio, we have a really strong area agency on aging network. It's supported primarily by the Older Americans Act, but then also we have been providing the administration of the home and community-based waiver and the Medicaid program for people over 60 for 30 years. And so having Older Americans Act, having the administration of the Medicaid waiver program, and another unique thing about Ohio is we have a significant number of local property tax levies that are geared towards social services for seniors, older adults. And so the area agencies on aging have the responsibility to assess the needs of their communities and develop a plan for how to address those needs. And that runs from screening, taking calls, the front door, as Tim referred to, for aging services, all the way through navigation for families and older adults to providing services or connecting people to services, and really building up the aging services network as well, assuring there are providers. You have, particularly in situations where there are rural communities and they don't have as many resources, it's really important to help build that network. So I would say that local community care and integration is a key component, and is something that we need to invest more in and recognize and also modernize as we talk about the reauthorization of the Older Americans Act. The things that Ohio has done is really been working in the Medicare Advantage space, and it's something nationally that ACL has supported community-based organizations getting more involved in. And I think that as we talk about these broad policy issues of looking at local community solutions and how to connect all of these options so people can find that right care and right service at the right time in the right place.
No question about that, Beth. And, we learn more from local initiatives sometimes than we do from what comes out of Washington. And so, Tim, you talked about the Cafe Encore model. And what I'd like to do is ask you to give us a little bit more about the model, how it supports the nutrition needs of older adults in Iowa, and what impacts of the program have you seen, and how did the state-federal partnership support the early implementation of the Cafe model?
Well, thank you, Bob. The Iowa Encore Cafe model was originally funded by a grant through the Administration and Community Living and also through a partnership with the State Unit on Aging in Iowa. And the Encore Cafe model was designed as a pop-up program that can go into really any location, if you will, and many different parts of the program can be replicated. We do not currently operate any senior centers, so we go into locations such as houses of worship or churches, um, parks and parks and recreation departments, libraries, and also we will be opening a new Encore Cafe in a community food bank here in the next month or so. We currently operate 4 cafes, and 2 of our locations are in especially rural areas, with one not having any services for seniors for over 50 miles. So it's that far south and such in a rural community. We operate just like a cafe. We use real table serviceware, for instance, with beverages left on the tables for them to serve, water carafes with lemon in there, and the volunteers. Some sites serve the consumers themselves. Some sites go through a serving line. Volunteers have full coffee service at all sites, and also they clear the tables just like in a cafe or restaurant, if you will. One site has also established, and I love this idea, and I can't take any credit for this, establish a dessert cart service where at the end of the meal, instead of pre-plating everything, the volunteers take a cart and bring it around. They can select out a variety of desserts. And we are currently averaging 45 to 65 meals per day at our sites, with the cafe and our local library serving over 90 meals. Everything is set up, served, and put away within about 2.5 hours. And we currently use a regional grocery store chain as our vendor for the meals. And we partner with the stores closest to each of our sites. And we use a common menu cycle that follows all state and OAA nutritional guidelines. And some also offer a choice menu depending on the site and each of the site preferences. In addition, we also offer nutrition education, guest speakers, visits from city government officials, and also generational programming with high school musical groups, homeschool children who come and volunteer, especially on the holiday meals, and then also a monthly pet food distribution at 2 of our Encore locations. Sites operate mostly weekly, and some are twice per month, and we're currently working on obtaining grant and local funding to increase those sites to weekly. Some grants have been obtained, and we're waiting on another grant decision. However, as many of us know, grant awards are becoming very hard to come by with significant competition and growing community needs. We did a service utilization study with census and existing consumer data to determine the best locations to implement these sites. And we started our cafes in Marion, Iowa, where we were only meeting 7% of the eligible population and any type of senior service needs. And currently we are serving well over 30% in just about 9 years. We used also the same method to recently expand into a food desert in a socioeconomic challenged location in Cedar Rapids. And one of our main challenges is maintaining and managing the attendance and number of meals served with the available funding. Our sites are so successful, but with increased food, labor, and mileage cost, increasing funding or increased cost is not keeping up with inflation. Before Encore, the average voluntary contribution, because we make an option for consumers to make a voluntary contribution, was $1.75 per meal. We currently average around $3.88. So it really shows that there is some perceived value.
Right.
And some sites also average around $5 per meal. We've also recently had to implement caps on the number of reservations that are accepted to maintain and work within our fiscal constraints. And if it wasn't for the collaboration with the state and also on the first ACL Innovations in Nutrition grant, we would not have the system or successes we have today. The ACL Innovations in the nutrition grant funding are vital in improving and updating the service delivery systems in a more modern and also innovative and cost-effective way.
Thank you, Tim. Congratulations on the great work out there, for sure.
Thank you so much, Bob.
So, Kim, Cathedral Square and SASH address the housing needs of older adults and individuals with disabilities, while also providing services like health check-ins and on-site programming. What positive health outcomes have you observed by providing services in this way, and what feedback have you observed from your participants?
Yes. Well, what makes SASH powerful is that it brings coordinated health and wellness supports directly to where people live. We're not asking older adults to navigate the disconnected system on their own. Instead, we integrate the affordable housing with the care coordination, wellness nursing, programming, mental health supports, and strong partnerships with local service providers. And the results have been exceptional. Third-party evaluation found that SASH reduces Medicare spending by upwards of $2,500 per person per year when adjusted to 2026 figures. SASH participants are highly engaged in preventative care. 96% had an annual wellness visit in the past year. We are also seeing improvements in chronic disease management, especially around blood pressure, through regular monitoring, education, and communication with their primary care providers. We also know SASH is helping reduce isolation. Nearly 3/4 of SASH participants report that they are not lonely, which is significant given how widespread loneliness is among older adults nationally. And we are seeing promising trends in healthcare utilization, including fewer high users of emergency departments. The strongest evidence comes from I'm sorry, I got my thing here. Sorry. From a peer-reviewed study in health services research, which looked at more than 6,000 SASH participants from 2017 to 2023. And it found that SASH participants gained more than one additional year of healthy life compared with similar Vermonters not enrolled in SASH. The study also found lower rates of stroke, heart attacks, heart failure, hospital admissions, and emergency department visits. Only 16% transitioned to long-term care, which is far lower than the researchers expected for a comparable population. But beyond the data, the participant feedback is what brings this work to life. One resident moved into our communities using a cane and believed that when she moved in that she was nearing the end of her life. And after joining SASH and participating in the walking program, she now walks multiple loops every single day. And she actually keeps her cane in the corner of her apartment to remind her how far that she has come. And this is what SASH does. It makes life easier, healthier, and more connected, often in ways that people may not fully realize until those supports are either needed or gone. It helps people remain independent, avoid unnecessary institutional care, and continue living with dignity in the place they call home.
Wonderful. And I want to commend you and Tim both for the focus on addressing social isolation and loneliness, which we all know, particularly in rural America, is particularly strong. So, Allison, what are the top most important trends or practices you've seen recently that could have an impact on long-term care administration on a state and federal level? And how could state and federal policymakers work together to further build on these emerging and innovative practices?
Well, we are seeing both some major challenges and some opportunities at both the state and federal level. I think the first and biggest challenge right now is reductions in federal funding for Medicaid, primarily from cuts through HR 1, the One Big Beautiful Bill Act. As I talked about, we're going to see about $1 trillion in reductions to state Medicaid budgets from the federal government over the next 10 years. And because home and community-based services are optional, they are the ones that are most at risk of being cut or reduced as states navigate budget shortfalls. With some other research partners, I've started to track at how states are responding to these types of federal policy changes. And I really didn't expect to see much activity in 2026 because most of the changes and cuts don't happen till 2027. But unfortunately, just in the last year, we've already seen more than half the states making significant changes to home and community-based policies, and about 3/4 of those are different types of reductions, things like new caps or limits on services or reduced provider rates. So that is, I think, the biggest challenge from the federal coming down to the state level. At the same time, I think there are some real opportunities that we are seeing, both innovations at the state level and I think momentum at the federal level. The first I want to highlight is some really incredible innovations that we are seeing in a handful of states. And I think the most notable is the WA Cares program, which is a public long-term care social insurance program that's recently launched in Washington state. And we're starting to see several states looking at that model. I think this is the perfect example, as Bob said, of states really being the laboratory of innovation that can inform federal policies. We've also seen a handful of states really look at using Medicaid demonstration authorities to reach what we sometimes call the missing middle. This is people who have too much income to qualify for Medicaid, but not enough income to pay out of pocket for long-term services and supports, and some really interesting work happening in California and Oregon. So that's state innovation. I'd say on the federal level, despite everything else we've been talking about, we are starting to see a growing interest in LTSS reform, with a number of different policy approaches being discussed. The Senate Finance Committee minority has kicked off a process seeking input from the public about a framework for long-term care reform. And one major idea is looking at creating a home care benefit in Medicare and also reversing and addressing the institutional bias in Medicaid, making home and community-based services mandatory. We see think tanks like the Brookings Institute mapping out what those kind of benefits, particularly the Medicare home care benefit, might look like. And then finally, there's even a little bit of bipartisan push coming through what's called the WISH Act, which is a public catastrophic long-term care insurance program focused on older adults. So lots of challenges in the short terms, but also I think some momentum and opportunities both at the state and local level.
Thank you. And of course, we're thrilled at BPC's initiative too, in the whole aging space and how it's going to contribute to future improvements in services. And so we're having a good conversation with them, listening, which is good. So, any good panel should talk about lessons learned and looking ahead. So, Tim, I'm going to start with you. You also serve on the advisory board for the Dine in Texas program, which partnered with senior nutrition programs in rural Texas to improve nutrition access to older adults while implementing select features from your cafe model. So why is this type of cross-state collaboration essential for improving nutrition across the country? What can other states learn from this work as they find innovative work? And what are some takeaways for federal policymakers seeking to support similar state level efforts? I'm tempted to give the answer to the last one, but I'll let you do it. Okay.
Thanks so much, Bob, for the question. Well, cross-state collaboration is as essential as in-state and local collaborations with these services. It's vital in combating serious issues like senior hunger and also to improve the quality of life for older adults throughout the country. Sharing successes and challenges in a collaborative manner helps improve and even sustain service delivery models throughout the entire nation, and also improves the cost effectiveness of our funded programs throughout the aging network as a whole. And we also live by the model of we are stronger together, and we all can understand that not one of us can solve the current amount of older adult needs and needs for services alone. So we really need that type of cross collaboration, whether it be the state, local, or especially across the country. As you talked about the DINE program, by sharing our successes and experiences, we are then able to help, for instance, Texas provide opportunities to help enhance their programs and be successful throughout the country. States can also learn that even when they have new and innovative processes or programs, they still learn new and innovative ways from other parts of the country. Working with Texas, I learned some ways we could enhance the programs that we currently offer through Encore, even with it existing for 8-9 years. And then also, one key takeaway would be that innovation works. Improving services, improving access to services for seniors can save medical costs in the long run, and innovation is key. Be open to change, and funding innovations in the field on any level will ultimately be beneficial in saving and reducing additional medical costs in the future for personal and also national levels. And it is much less expensive to provide community-based services such as senior nutrition and other programs our other speakers have mentioned than it is in an institutional setting. By supporting these efforts, we are a complete team as a network and can help keep older adults in their communities as long as possible.
Excellent. And of course, part of the team is also older adults themselves, but no doubt provide you with some input to guide you a little bit too, right?
Definitely, most definitely.
And I'm sure even if you don't ask them, you'll get it from them, right?
Exactly. Exactly.
Okay, Beth, the quality, affordability, and accessibility of long-term care impacts everyone, whether it's caregivers, current or future care recipients, or as taxpayers that help fund the systems that provide care. How can federal and state policymakers best work together to improve long-term care in ways that strengthen communities and support families across generations? And from the state perspective, what's the one thing you want to ensure federal policymakers prioritize as they think about federal reforms to build a long-term care system that works for everybody?
Well, one thing I want to reiterate that you just said, I think needs to be clear that this impacts all of us, not just as taxpayers, but that a system that we want to see for ourselves. Everybody is either an older adult or aspires to be, and is also probably has some form of caregiver story. And so in thinking about federal policy, that's kind of the goal is to look at what would we want in place for all of us as we age. And so that would be one, overarching takeaway from this discussion, but also really thinking about, listening to all of these different programs that are really great programs that can serve older adults, but they have to be able to access them and understand what's available to them. And so the thing that I see that would be most important is to recognize the front door to aging services as a service itself. And I don't think there's enough prioritization on that at this time. There's not funding for it to sufficiently staff an effective front door that can connect people to all of these services. And so it's not 211, it's really helping people when they're in a crisis, family members, and helping them navigate a very complex system that includes the health care and the social care, and with different eligibility requirements and different scenarios in which they might benefit from services. One of the things that the area agencies in Ohio do is a free long-term care consultation. They will come to your home and assess where you're at and where the family is at and what you might be eligible for. And then they help you connect to those services, which may be through the Area Agency on Aging or other providers. And I just think it's underestimated the value of that work and what it takes to make that successful. But you really don't want to have to scroll through a list of providers or have a document that gives you this list and you have to contact all of them and try to figure out how it fits for your family. So that would be a huge improvement in our system if we really recognize that this is a service that we would all want to have available.
Very good points on all of it. And having just come back from the U.S. Aging Conference and hearing about the focus on social care as a critical component of healthcare, the only thing I would say is let's build up on social care, but not make it as complicated as healthcare. And then I think we'll be doing really well as a country, right? Allison, the federal government, through the Older Americans Act and other programs, has long supported some of the most important supportive services like nutrition programs, home modification grants, all to support aging in place. What lessons can be learned from the state innovations discussed today and the collaboration between the federal and state government to support these kinds of programs? And what are the greatest opportunities for bipartisan reform for federal policymakers to better meet the needs of a changing population?
I want to build off some of what Beth just talked about. We've talked about a lot of programs today that are critical to supporting older adults aging. Medicare, Medicaid, affordable housing, SNAP, and the Older Americans Act. And I think you use the word, Bob, best kept secret on the Older Americans Act, but we need to be getting out there and making sure policymakers and the broader community understand what the Older Americans Act is. It is exactly like Beth said, it is the glue to helping people access all of these critical supports. 1 in 6 older Americans get services through the OAA, and it reaches some of the most underserved older adults. It is an incredible return on investment. Every $1 invested leads to $3 saved, including almost 2 million extra days living in the community, because these services help people avoid hospital stays and institutional care. The Older Americans Act is only becoming more important because of the growing number of older adults and frankly because of cuts to other safety net programs that older adults rely on, like Medicaid and SNAP. Yet few policymakers know about the Older Americans Act than programs like Medicare and Medicaid. So we have our work cut out. But the good news is, as Ronnie mentioned, we do have strong bipartisan support for the Older Americans Act. We almost got a reauthorization over the finish line in 2024 that recognized the growing need and increased appropriations and modernized the bill in some kind of way. And just last month, because of advocacy, the Senate repassed that same bill by unanimous consent. It is a critical bipartisan step that I think with ongoing advocacy and focus is doable to get over the finish line in this Congress. And I think it is really one thing that we can do to move the needle. The last thing that I'll just say in terms of bipartisan reforms, and we've all talked about it in some ways, is the interconnectedness between the services that older adults and people with disabilities need and family caregivers. There is actually very strong bipartisan support for caregiving programs and for helping support caregivers. I just finished, and I'll be rolling out an analysis of federal legislation introduced over the last 10 years, an incredibly hyper-partisan Congress, yet more than 60% of the 175 bills were bipartisan. I think for us who are looking to advance community living and the long-term care system, it is really critical that we frame this about the interconnectedness between the barriers in accessing services and how families are having to step in and fill that. And I really think that can help us move the ball forward in a bipartisan way to help get both people with disabilities and older adults, as well as family caregivers, the supports that they need to age in place and remain in their own communities.
Thank you for that. And let me take this opportunity, since we have more than 365 people on this webinar, there's got to be more than 100 members, House members on this group, maybe more. So those of you who took the time to join this webinar, contact your House member and urge them to support and pass the Older Americans Act. Go visit, tell them to come visit a program during the long August recess that they have. Take advantage of the advocacy opportunity that's there. The Senate has given the Older Americans Act a wonderful blessing with this bill. And all the House has to do is accept that, and we would be home on the finish line and celebrating that wonderful victory. But whoever's on this webinar, go to your House member and just deliver that message. Support the Senate bill, get it done this year. So we do have a fair number of activities in the chat. And let's see. Cameron, I don't know what order you want to do this. I'm going to just sort of go in what I see here. Now, this one looks like it could be fun for everybody. Why has it been so hard to get policymakers to understand the return on investment, the value of home and community-based services versus skilled nursing costs, and what messaging is needed to continue driving home that point? Kim, I'm going to start with you on that one if you wish to respond.
Sure. Yeah. I mean, I think that unless you're have a loved one or you yourself are dealing with this circumstance, it's somewhat silent to the world, and it doesn't have the attention obviously that it needs. And I mean, I'm sure this is true across the country, but I know for us in Vermont, we run two long-term care communities, and we have people living at the hospital with nowhere to go because we have had residential care facilities closed, especially during the pandemic. We have staffing crisis, so there are a lot of complex issues here that have to be addressed, and we all have to come together to work on them. But I think to your question, I just think it's something you're not thinking about until you're living it, until you're breathing it, and then it's honestly too late for many families and many people.
Bob, can I just briefly add to that? Yes, and I think this is one area where historically we have had bipartisan support, both at the federal executive branch and Congress and state levels, and what's been called historically kind of rebalancing to really match what has historically been a major investment in institutional care like nursing homes to being able to support people in their own community. So I absolutely agree with Kim that sometimes people don't think about it until they experience it. Yet, as a policy matter, I'd encourage everyone to come in with the data. We can serve 3 people in the community for every 1 person in a nursing home, and it's not because their needs are different. When we look at preferences, when we look at outcomes, we need to keep emphasizing that and really encourage states to continue using, especially in this moment in time where they are facing budget shortfalls. I think we are at risk for states saying, kind of for short-term gains, they might be willing to roll the dice with long-term costs. And I think it's up to us in this moment to remind people about the very long-standing bipartisan support that we have seen for expanding community-based services to meet people where they are and what they need and what they want.
Now I'll go to Beth, please.
Well, yeah, I can build on this as well. I think there's a misunderstanding of the value of the home and community-based services. People immediately, when you talk about older adults, people tend to default to nursing homes. And unfortunately, that also leads to kind of a stigma and I think ageism, frankly, that I think people don't understand that this is something that impacts all of us and that there is value in enabling older adults to remain in their communities, to contribute to their communities, to be able to engage with their families in a meaningful way. And as it was said, if you haven't experienced the situation that we have now with a loved one or yourself, then you don't really understand this system at all. You have no idea what's in place or not. And I think it's incumbent on all of us to tell that story. It's definitely the data, and it's also the story of what this means to people. And to all of us, thinking about what you want when you get to a point where you might need support.
On this question, Tim, bring it home.
I would say to compound on everyone else that has mentioned it, I would say data drives a lot of information, especially at the state and federal level. But then also really look at and find those real personal local stories about the successes and the programs. Yes, we can save this much, and we've done so much improvement on certain scores, but it also drives home the case studies and the real life stories of how they've improved their lives, being able to leave the hospital and move to a private apartment on their own, or the different meals they were able to get off certain types of medicine. and to help the caregivers get a little bit more extra time to themselves, and just the different quality of life to really drive home not just the financial benefits, but also the personal benefits, if you will.
Wonderful. Even though the group violated the rule about not, sneaking looks at the chat, thank you for those who responded while you also snuck a look at the chat, because that is very important for people to get a sense that their questions are going to be answered. So thank you for doing that. Allison talked about HR1, and question for either Beth, Kim, or Tim. Do any of your programs or programs you know of offer or plan to offer assistance with benefits access given the upcoming recertification and work requirements in both Medicaid and in SNAP? So anybody want to take a crack at that?
Well, I think that's something that the area agencies on aging assist with all the time in terms of helping people maintain their benefits and connecting them with the appropriate agencies. I think there's just going to be a lot more of that needs to be done, and to understand what the policy changes actually are and what they mean to people. So absolutely, that is an area that we have been following closely. And in terms of advocacy, have been advocating with our state policymakers on how to minimize adverse impact on the population.
Yeah. Tim or Kim, any thoughts? Okay. All right. I think this will be our last, coming down to the last question here, because this brings another issue up that has been alluded to. But can you speak to the increase in mental health needs among older adults and how to support them within a fragmented mental health system? Beth, you look like you're nodding your head. You can go first.
Well, I'm agreeing with the challenge for sure, and it's something that we talk about a lot. It's definitely we continue to see this as an issue and an unmet need for older adults. And so again, it's telling the story and advocacy. We have had some innovations in Ohio connected to this issue. One is we've had an area agency on aging actually house a therapists within their agency for situations where older adults have had challenges connecting with their local mental health agencies and or don't feel comfortable with that connection because it isn't really focused on their needs. And so that person would actually go to people's homes to provide that support. So that's just one of many innovations that we're thinking about in terms of those connections, and just really working on both supporting the connection to our local mental health system and we need to advocate for more support for older adults in this space.
I would love to add to
go
that
ahead,
if I
Kim.
could. Yeah. So we just, as the housing provider, we're seeing this and obviously it can affect the entire building, and the neighbors and the peaceful enjoyment of the premises by everybody. So we have actually added and partnered with our designated agencies to add embedded mental health clinicians right into our affordable housing. And I don't know about around the nation, but Vermont's been pretty strong about having clinicians do ride-alongs, like with the police officers, to help there. And although I would not discourage that model because that has a place, what I would say is let's get to it before it reaches a police call, right? So where people are living before it gets escalated, de-escalate the situation by having the clinician there. And we have just found incredible results. We're also having a huge amount of male participation, which is usually especially during, in the 50 to 85 category of participation is usually very low. So huge participation there. We're also seeing a lot lower eviction rate as a result for not only the person who's causing maybe the concern or harm, but just actually education and understanding and tolerance by their neighbors.
Thank you. I'm getting that signal that says we're getting ready to wrap up here, folks. So let me thank Beth, Tim, Allison, and of course, Kim, for your participation in this panel. Let's thank the audience. I mean, almost 400 people took time to listen to what had to be said. And I think if we didn't get to all the questions, we'll find a way to get them to you, and maybe you could respond separately. Yeah. Let me also remind the attendees of the BPC's Aging Initiative that we talked about a few times. More information about that can be found on the BPC website. Look out for upcoming webinars on ensuring financial stability for older adults and as is talked about many times today, supporting the caregiving workforce. So again, my thanks and appreciation to the panel and to BPC for this wonderful webinar, and I wish everybody a wonderful day.